Right-sided facial numbness. Main causes. Right-sided facial numbness is a symptom of an underlying condition rather than a condition in itself. Different nerves control facial feeling and muscle movement. One-sided or unilateral facial numbness can occur when these nerves become damaged, inflamed, or compressed. Some people may experience a complete loss of feeling in the affected side of the face. Others may experience a tingling sensation. There are many different causes of right-sided facial numbness. Some are more serious than others. Determining the cause of facial numbness is vital for receiving effective treatment for the underlying condition. Possible causes of right-sided facial numbness include stroke. A stroke is an interruption in the blood supply to the brain. It is one of the most serious cases of right-sided facial numbness. The most common cause of stroke is a blocked blood vessel in the brain. These blockages are usually due to blood clots. A stroke can also occur when a blood vessel in the brain ruptures and bleeds out. According to the Centers for Disease Control and Prevention of CDC, every year stroke affects over 7,95,000 people in the United States. Around 1,40,000 of these people die as a result. Early treatment for stroke can be life-saving. Additional symptoms of stroke may include headache, confusion, loss of balance or coordination, problems with vision, problems walking. Treatment. Treatment for stroke depends on the type. A person who experiences stroke as the result of a blood clot will usually receive a thrombolytic. These are drugs that help break up blood clots. A person who experiences stroke as the result of a ruptured vessel may require surgery. The goal of surgery is to repair the damage and prevent further bleeding. Often, stroke treatment reduces facial numbness. Bell's palsy. Bell's palsy is a type of facial paralysis that usually affects one side of the face. Bell's palsy develops in response to inflammation or compression of the nerves that control facial movement. The underlying cause of this nerve damage is not clear. However, the condition tends to occur more frequently after a cold or the flu. According to the National Institute of Neurological Disorders and Stroke, about 40,000 people in the United States develop Bell's palsy each year. Although people of all ages can develop it, it is more common in people between the ages of 15 to 60. Additional symptoms of Bell's palsy include jaw pain, ringing in the ears, loss of taste, dizziness, headache, drooping of the eyelid or corners of the mouth. Treatment. Most people recover from Bell's palsy without treatment. However, treatment may help alleviate the symptoms faster. Steroids may help reduce inflammation of the facial nerves and speed up recovery. Taking over-the-counter non-steroidal anti-inflammatory drugs can minimize any pain and discomfort. However, people should not take this alongside steroids. Multiple sclerosis. Multiple sclerosis is an autoimmune condition that involves damage to the nerve cells in the spinal cord and brain. Multiple sclerosis is a progressive condition, which means that it will usually worsen with time. One of the most common symptoms of multiple sclerosis is numbness of the legs, arms, or face. Numbness may affect one or both sides of the body. Other symptoms include blurred vision, fatigue, impaired coordination, speech difficulties. Treatment. There is currently no cure for multiple sclerosis. However, taking disease-modifying drugs such as steroids can help reduce symptoms flare-ups. These drugs suppress the inflammation responsible for nerve cell damage. Hemiplegic migraine. The initial symptoms of a migraine episode can differ from person to person. Some people experience an aura shortly beforehand. A migraine aura is a sensory disturbance such as a change in vision or an unusual bodily sensation. People with hemiplegic migraine have an aura that causes numbness and weakness on one side of the face, body, or both. Facial numbness may develop before, during, or after the migraine episode. Additional symptoms may include headache, sensitivity to light, nausea, problems with muscle coordination. Treatment. Hemiplegic migraine is much less common than other types. It requires specialist treatment. Other possible causes. Some other possible causes of right-sided facial numbness include facial injury, infection, tumor, shingles, dental surgery, allergic reactions, nerve compression. When to see a doctor. Anytime a person has facial numbness for an unknown reason, they should see a doctor to determine the cause. See a doctor as soon as possible if right-sided facial numbness gradually worsens, develops after a head injury, spreads from the face to other areas of the body. Some causes of right-sided facial numbness require urgent medical treatment.